Welcome to ED Clinic UK. In this video, we'll be going through a typical patient journey. So many of the patients who contact us have been either diagnosed with ED or they self-referral. So once you had a contact, we got branches all over the country. One of the specialist practitioners, so all of the practitioners are well trained in focused shockwave, which is the treatment of choice, and we'll arrange an initial complementary session. So in this session, we'll be going through your detailed medical history. So we know that conditions like diabetes, high cholesterol, low testosterone are linked with ED because it's usually linked with the bigger medical problems. And most of the time, we'll have to arrange a blood test. This can be done through a GP or it can be done through a simple pinprick test where we'll go through all the key markers to make sure that you're the appropriate patient. We'll also go through some screening questionnaire looking into your urological history and also your sexual history, making sure that you're appropriate. And also that will give us an idea of how long the sessions will be. So the typical dosage of shockwave is 6 sessions, which should be completed anywhere within 6 to 9 weeks. So most patients will choose to have once a week. Some can have twice a week. Based on your screening questionnaire, people who are more towards the moderate to severe ED might need 12 sessions. So in that cases, they might complete 6, have a break for 2-3 months, and then do the second. So on an initial consultation, we might be able to tell you exactly whether you need 6 sessions or 12 sessions. And once we have gone through that, we usually give you a cooling down period for about a week just to go through all the information, and you'll have an opportunity to have a look at the device. And once we book in for the treatment, this is the exact device we'll be using. So this is a focus device, not radial, which is used in many physio clinics, specifically designed for erectile dysfunction, made from Stowe, Switzerland, and the energy is tailored so that the treatment is painless. So one of the main advantages here is it increases the blood flow and it doesn't cause any major side effects. So the treatment protocol takes around 10 to 15 minutes. So we split the treatment into 3 parts. So initial treatment, we'll be putting lots of ultrasound gel and we'll be giving around 1,000 impulses at the base of the penis. And once we've done that, we'll be giving another 1,000 around the shaft. And then the final treatment will be at the base of the penis here, more towards the testicles, around the crural region on both the sides. So it's a fixed protocol, 3,000 impulses, talking around time of not more than 15 minutes maximum. No downtime. You could just check in for a 20 to 30 minutes appointment, have it done, and just go back to normal life. Bit sore for 3 to 4 days, increased sensitivity, no long-term effects. So that sort of is your quick treatment. It's non-invasive. You don't need to take any drugs, and that completes. And following 6 sessions, we'll be repeating your questionnaires to see the improvement. A common question asked is, what's the success rate? The average success rate is around 70%. It depends on your age. Obviously, if you're younger, it's quicker. How well you control your diabetes, your testosterone level. So all these factors will be going through. Obviously, some will have increased success if they're younger, or if they don't have other medical conditions, or if you're generally fitter. So it varies person to person. But the most interesting thing here is it's the only proven treatment which sort of has been shown to address the root cause, rather than just giving like medications or injections. So if you're interested in shockwave, which is a proven modality, contact us at ED Clinic. One of the practitioners will be seeing you on the initial appointment and check whether this is the right treatment for you. And it works really well for vascular erectile dysfunction. So it's really important that we get the medical clearance and also the appropriate blood test before we do the treatment. So that concludes the video on the typical patient journey at ED Clinics.